Now I've been looking at costs of intensive care, costs of vaccines, Googling various terms and looking on this website, which is a vaccination costs website. Okay, Vaccination UK. Consultation fee. So, I mean, some of these are private, obviously, yeah, for travel vaccines, etc. Okay. Cost of healthcare for novel coronavirus looking forward. We need a vaccine as soon as possible. We need drug treatments as soon as possible also. That's the soonest thing we need. Remdesivir and the anti-malaria drug, hopefully they will work. But looking at the costs of this, I think it's very important, because can our economy stand it? Okay, so the average cost of a night in hospital in the UK, let's put the UK in capitals, okay, United Kingdom, £400. Now presumably this is an average across all hospitals and all beds, so that will include for observation or general ward or surgical ward, acute ward, cardiac coronary care unit, ICU, which is probably similar, I don't know, it's like an acute ward, depending, okay, whatever those things are. You can just take a screenshot of this if you want, you're very welcome. So the cost of a night on an average general ward is actually £195 a night. You know, that's not as much as I expected in some ways, actually, because you get well looked after in the NHS, usually by very nice people. Cost of a night in ICU, this wasn't quite as much as I expected, £1,300 to £1,400. And that's over about the last 10 or 20 years, so I'm not sure if it's exactly right, because there are a couple of variables to those figures. And it depends how intensive the care is, doesn't it, maybe? But, you know, that's an average, I guess. USA, by the way, it's $10,000. What, £8,000 for the first night? Got to be a bit of profit in there, hasn't there, yeah? Rather a lot of profit in there. Rather a lot of stuff for the insurance companies, rather a lot of juice in it for them. Then 4K, it goes down after a couple of days to a plateau of 4K, which is still, I'm going to see £3,000, so it's still more than double when it settles down what it is in the UK. Just to bear in mind. Compare that to a cost of the vaccine from this website, £40 to £150 generally, privately. Now what it had on there, the lowest cost vaccine was a flu vaccine, which is £15 for 1 year. But you need that every year, so it's £15 a year. That's not a lot, is it really, for a flu vaccine? That is dirt cheap, actually. Most others were 50 to 150 or 40 to 150, whatever. The most expensive ones were for HPV, human papilloma or meningitis B at £155 each on that website. I'll say the average is about £80. So even if a vaccine for nCoV was a £200, you know, it's new. You need to cover the costs. Even if it's £200, compared to what you're going to suffer and what the rest of the country is going to suffer, it's dirt cheap, isn't it, really, to be quite honest. If it was an average cost, let's say about £80 for that vaccine, and this is for a virus, that's for a virus as well, yeah? So whatever, it's going to be somewhere between those probably. So if it was £100, it's a quarter the average cost of a night in hospital, of a single night. It's a half the cost of a general hospital ward per night, and it's a 15th or 16th of the cost of a night in intensive care, and not nearly as unpleasant to have a shot in your arm, yeah? So that just shows how much the healthcare system is going to spend if a lot of people are in ICU, perhaps for 10 to 14 days. You're going to be talking about £14,000, maybe even £20,000 for the treatment of somebody with COVID. There was a lady on Chris Martinson's website he showed a screenshot or a case study where a lady got a bill for $34,000 for her nCoV treatment. And I don't even know that she was in ICU in the United States. She got an invoice for $35,000. That's absolutely incredible. You know, maybe she spent a couple of nights in ICU, maybe she didn't. That was just totally outrageous. But you can see that even with the NHS, for 10 nights in ICU, it's going to cost 14,000 quid. A vaccine's probably going to cost sub 100. That's all I've got to do for today. No forecasting today. This is just looking at stuff. And again, stay safe, self-isolate as much as possible. I didn't go out anywhere today. I'm not going out shopping as often. I've got some cans in. I'll eat my canned food if I can't go shopping, if I don't want to. And I'm not eating any cold food. I'm not eating any salad and stuff like that after today. It's been in the fridge for ages. I'll peel a couple of layers off the lettuce before I eat it, and I shall wash the tomatoes, and I shall wash everything. My apples and oranges have been here for a couple of weeks. I shall wash them. Might even wash them with soap and water, actually. But I'm certainly going to be very careful what I do with any cold food. And I certainly wouldn't buy myself any cold food out of a store. Just not going to do it, you know. Why would you, to be honest? And if I do, I'm going to heat it up when I get home, okay. My Mr. Kipling's pies, which I like, I'm going to put them in the oven. Just makes sense, doesn't it? Anyway, it tastes better when you put it in the oven. Yeah, hot meals from now on. Okay guys, thanks very much for watching. Ding the subscribe. Please like my videos. Please pass them on to other people. I really want a bigger audience for this. Not for any reason other than I think it's important information. I think my forecasts have been working. And we need people to pressure government, because I think that we need people to pressure government. Look at my forecasts and write to your MP. Is my advice. If you're in the United States, write to your senator or whatever. Just email them, deluge them, give them loads and loads of hassle. Of course they'll probably ignore it, but you know, write to the opposition. Write to the opposition so that they will bring it up in Parliament. You know, if you write to a Tory, it's a waste of time because they're in the government. Write to Labour, they'll probably ignore you as well, because they're probably all in it together now. You know, it's a government of national unity. They know what's going to happen. They know how bad this is going to be, and they don't really know how to deal with it yet, I don't think. But we'll see. We'll see. South Korea shut down its epidemic. China did, allegedly. And I think South Korea is about to break out again. So they're not really out of the woods yet, nor is China. It's going to be a very, very, very long haul. As one of the European people said, I think one of the German ministers said, it's going to be a marathon. This is not it needs to be a sprint at the beginning, but it's going to be a marathon. Okay, so hang in there guys. Thanks so much for watching my videos. Please go look at my website, covid19stats.blogspot.com. Whenever I have any time, I'm going to put stuff on there. Time is pressing, but you know, it's a labour of love, so please go and have a look at that. My new forecast for Italy, which I haven't put on there yet, they had a worse data point today, so they went up from 250,000 to 290,000 total cases, with 6,000 at the peak on the 2nd of April. 6,000 new cases there will be on the 2nd of April. They're already getting there. They're already at more than 4,000 a day. I'm going to try and start to forecast the deaths for Italy, which is not going to be a nice thing to do, but I haven't started doing that yet. So thanks for watching and bye.